It's now time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. Globally, we're seeing a huge decline in the number of COVID-19 cases, but as experts have warned, there needs to be more preparation for future resurgences.
That's right. So what are some of the concerns moving forward, and how can the global community prepare for another possible surge? Now, for this, we connect with Ben Cowling, Chair Professor of Epidemiology at the University of Hong Kong, joining us today. Good morning to you, Professor.
Good morning.
Let's kind of start off with what's going on in Shanghai right now. We know that they're seeing for weeks a massive surge in cases, and this is despite the fact that, let's face it, China put in some of the stricter measures in place. Seeing what's going on in Shanghai, what's going on maybe in Beijing right now as well, is it just inevitable that we just got to have the Omicron variant before it settles down again?
Right. I think in Shanghai, we've seen a large number of cases. I think there are 20,000 plus per day, but the numbers are coming down just recently, the last few days. It looks like they may be able to get on top of it and ultimately bring case numbers back down to zero, only having maybe 1 or 2% of their population infected, which of course is a very low proportion of a population to be infected. So it shows that it may be possible to beat Omicron at extreme cost, and other parts of the world have decided that that's not feasible, and vaccines provide a more sustainable long-term solution to dealing with COVID than these very stringent public health measures in Shanghai, and I think in Beijing now as well.
And globally, we're seeing a general decline in the number of cases, but there are still worries surrounding the recombinant variants of Omicron. Are we seeing any new cases flare up in any other parts of the world?
Yeah, I think the one that we're looking out for at the moment is BA4. But of course, from week to week, there's different things reported in the news. So you ask me again next week, it might be something different again. But for now, it looks like BA4 may be the next strain that spreads around the world. But I don't think it will have as much impact as BA1 and then BA2 have had, because we have a lot of immunity in our populations now from infections and from vaccinations. So right now, COVID will be less of a threat. Next winter, maybe it'll be back again with another new variant. We'll have to be careful again, but I think we can relax a little bit now because we've passed the worst with Omicron.
Yeah, I think a lot of us are kind of getting, losing touch on how many different variants there could be moving forward here. Something to kind of look forward to, I believe, in May. The U.S. is going to be hosting their global COVID-19 summit. What do you think are some of the biggest issues that need to be discussed in that very event?
Well, I'm sure there'll be a lot of different things being discussed, a wide range of topics. Of course, the reviews of how governments have done in their response to COVID would be a really important thing to start looking at and start assessing. For me, the biggest question going forward is vaccines. When are we going to have updates to the vaccines with the latest strains? Because, of course, the vaccines that we're using today are using the strains from 2 years ago, and we need to update them sooner or later. I think sooner. And then we need to think about how much we should be using vaccines, how many doses per year, which groups are the priority groups, and so on. And there's a lot of research that needs to be done to feed into those kind of decisions and recommendations.
Professor Cowling, now, South Korea is soon set to remove mask mandates, or there's a discussion about it at least. And, well, how is the conversation going on in other parts of the world?
Well, of course, a mandate is when everybody has to do it. And that's a stronger thing than just a recommendation to say that people should wear masks, we encourage it, but it's not mandatory. And I think we're going to see in Korea and elsewhere, of course, is that the mandates will be rescinded, but some people will still choose to wear masks, and they're going to do their own personal risk assessment. I think that's a more sustainable solution going forwards. I don't think that actually masks do much good outdoors. It's an easy thing that we could relax, and it won't have much impact on the pandemic. Masks in public transport might be something that we keep in place for a little bit longer, because that's a crowded indoor setting, lots of people. If we have masks there, maybe it would do a little bit of good and just help the numbers to come down a little bit further before we relax that as well.
So, Professor Cowling, another thing that's kind of another concern that's being raised right now is some of the symptoms that are coming out for those that have either COVID or are currently with COVID. And one of the weird symptoms that's been coming out is the fact that some people are getting, basically diabetes. They're diagnosed with diabetes. Why is that the case, and why are we seeing so many people with diabetes after being, contracting COVID-19?
I don't think it's a large number, but there have been a number of studies which establish that there is an increased risk of being diagnosed with diabetes after having COVID. But it's a low risk, it's not a high risk, and it's one of many different things that are grouped together under the umbrella of long COVID. Some people may lose their smell or taste for a period of time. That's not so serious. Other people have trouble walking up the stairs after they recover from COVID. That's serious. And then, as you mentioned, there's conditions like diabetes, maybe other chronic medical conditions that develop. And I think we don't have a full understanding of how frequently this happens, and particularly how much it happens in people who've been vaccinated, because a lot of the scientific research that's been done and reported today is actually research that was done a year ago before vaccines were available. And I suspect that there's less long COVID now in people who are vaccinated than there was maybe in the earlier days of the pandemic before vaccines were available. But we'll see. That's really a very active area of scientific research around the world.
Professor Ben Cowling, thank you so much for your insights today.
Thank you.